So guys get super worried when they see an abnormality of the scrotum, okay? And it's certainly when they see something on one side of the scrotum that looks like a bag of worms, they freak out. Let's talk about what this could be. Hey guys, Dr. Segel here. So the question is, the left side of my scrotum looks like a bag of worms, but the right side is normal. Is this okay? What if it's on the right side? So let's talk about what this could be. And at the end, I'll give you my pearl of wisdom for the one time that it's really important to see somebody about this and it's a cause for concern, okay? So make sure you stay tuned until the end to get that tidbit of information. So typically this is something called a varicocele, okay? So if you look at this schematic here, this is your testicle, all right? And this is the vein. This blue thing's the vein that drains the testicle, okay? It's venous drainage of the testicle. When those veins, there are actually a number of veins down there, get enlarged, that's called a varicocele, okay? So it's a dilation of the veins in the scrotum. Varicoceles form typically during puberty, and that's when guys will notice them. If you take 100 guys, 10 to 15 of them will have a varicocele. So it's super, super, super common, okay? I want to tell you that. Most of the time, varicoceles cause no problem. They're harmless, okay? But they can cause pain, they can cause problems with fertility, and they can cause a discrepancy in the size of the testicle. So sometimes with really big varicoceles, the drainage from the testicle will be worse, and that impaired drainage will affect how big the testicle can get, okay? So you'll notice a size discrepancy between one testicle and another. Is when do you do something about this? Remember, 10 to 15% of guys in the population have a varicocele, but it's not like 10 to 15% of guys are getting a procedure or getting this fixed, okay? So if you have one of the problems associated with the varicocele that I mentioned, problems with fertility, problems with chronic pain down there, problems of a size discrepancy between the two testicles, and certainly in the pediatric population, sometimes these will be fixed prophylactically, okay? Then it's a cause to consider treatment for it. Now, what are these treatments for it? So there's no medication that can be given to fix a varicocele. There's a surgical procedure that we can do either with a microscope, a laparoscopic technique, or an incision technique to find the veins that go into the scrotum, that go into the testicle, and tie off a number of these veins, okay, to improve the varicocele and make it the same size as the other side, all right? There's also a radiologic procedure where a radiologist, an interventional radiologist, can do what's called embolization or cut off the blood supply to some of these veins in the testicle to treat the varicocele, which is something that's oftentimes done. So there's very minimally invasive approaches to deal with this for sure. Now, if you feel something in the scrotum and you don't know what it is, don't just assume it's a varicocele. Certainly, you should see somebody and they should evaluate you and figure it out. But these are the times, kind of the indications that I mentioned are the times that we do something about a varicocele, okay? Now, and this is my pearl of wisdom, all right? And this is super important. Left-sided varicoceles are super common, okay? On the left side, having that bag of worms, very, very common. Right-sided varicoceles are uncommon, okay? So if you notice on the right side, that's a cause for concern, okay? And I'm going to tell you why. Typically, the left-sided vein that drains the testicle goes directly into what's called the left renal vein, or the vein that drains the left kidney. And it's almost like a T. This intersection is almost like a T. And because it's like a T, blood will flow backwards very frequently, and that's why you get a dilation in the veins down here, right? So it's like a T intersection, blood's flowing backwards because it's hard to push up against gravity all the time. And so on the left side, you'll oftentimes get a varicocele, and it's super common. On the right side, that's not the case. The drainage goes directly into the inferior vena cava, and it's not a T. It's not this, okay? It's typically like an oblique drainage. All right, something like that. And so because of that, it's less likely, because it's an oblique or it's kind of a askew drainage into the inferior vena cava, it's less likely that that blood flows backwards into the testicle. So what we get worried about is if we see one on the right side, we want to make sure there's no mass in the abdomen, because if you have a mass in the abdomen, it can cause impaired drainage from the testicle, and you'll see a right-sided varicocele in certain circumstances. So make sure that if it's on the right side, you certainly seek medical attention relatively soon, because that can signify in certain cases an abdominal mass. So that's the tidbit of information I want you guys to remember from this. But hopefully that gives you kind of varicoceles 101, gives you some information on how to think about them, when we do something about them, and how we fix them if necessary. But thank you so much for listening. We certainly appreciate it. Please subscribe to our channels. We release new videos every week. Thanks again, guys.